Welcome back. We are answering your questions about the coronavirus with Cone Health's Infection Prevention Medical Director, Dr. Cynthia Snyder. You can text your questions. This question is, what are your thoughts about me and my husband going to the beach after Christmas if we don't go to restaurants and just stay to ourselves?
I believe that sounds like a pretty safe plan. So as long as you're staying within, that your household bubble, and going to and staying in one place, and especially if you're getting takeout, you're minimizing that risk of going into a restaurant that might not be well ventilated.
This question is, are we seeing less cases of the flu so far because a lot of people are being cautious about COVID?
Correct. So this typically would be considered over the next few weeks the beginning of flu season, and right now the rates look lower than usual, and so we feel that the onset of influenza will probably be delayed, and our thought is it is due to folks wearing masks more vigilantly, I would say.
Is there any truth to people who get the flu shot being more susceptible to testing positive for COVID?
No, I think actually that must be some sort of misinformation. The flu vaccine really protects you from getting influenza and having severe form of it, and it should not cross-react with any testing for SARS-CoV-2.
So this person says, should I be wearing a mask when I go through the drive-through?
If you are going through the drive-through and you're not you're within 6 feet of the teller or exchanging like your card or your coffee, I think you should wear a mask. I think that would be the safest thing for you.
And this is a question I'm sure lots of people are asking, and I don't know if there's an answer. What would need to happen in order to have people stop wearing masks and for it to be safe to do so?
I think that's a little bit of the million-dollar question. We don't really know how long that SARS-CoV-2 and COVID-19 is going to be a threat into our community. We suspect it's still going to be a good year from now. And we really are optimistic today learning about how effective one of the vaccine candidates is. So, next spring and next summer, as more individuals are vaccinated, I suspect that the threat of COVID-19 will be a little bit less, and we may not need to wear masks in the middle of the summer, but it's hard to tell.
Mm-hmm. This question is, are more kids getting COVID now?
Right now in our community, we are seeing a steady increase in cases, and in part, some of that is due to a younger population. We have seen an increase of cases among kids between the ages of 0 and 17, as well as younger adults between the ages of 18 and 24, and I suspect that's more the university crowd, and it's challenging. I think we still see folks that feel that they may be not as susceptible to getting sick, and so maybe they're not as cautious as they should be.
Mm-hmm. Really quickly, whatever happened to the potential for a mouth swab for COVID?
So there is a saliva test. However, I believe that test is actually you have to spit in some sort of receptacle. And then there can be some different candidates, but I'm not aware of the one that's like a cheek swab as of yet. Okay. I wouldn't be surprised if that comes out pretty soon.
Yes, I would imagine so. Thank you so much for joining us today. We so appreciate it. Thank you for sending in your questions about the coronavirus.